Since yesterday's update, we have confirmed 57 new cases of COVID-19. This means that 358 cases have now been identified in our province. We suspect up to 28 of these total cases may be community transmission. 19 individuals have been hospitalized, of which 7 are receiving care in the intensive care unit. 3 Albertans have recovered from COVID-19 so far, according to our data. We are working on a streamlined process for getting recovery data, and we anticipate those numbers will change. Today, I must also sadly report the second death from COVID-19 in our province. This individual was a female in her 80s and a resident at the Mackenzie Town Continuing Care Centre in Calgary. I would like to extend my sympathies to this woman's family and loved ones. This news is extremely sad for all of us. Though we are doing everything we can to limit cases of critical illness and death from this serious virus, tragically we know that deaths will occur. We have also learned that 1 staff member and 2 other residents at this facility have also tested positive for COVID-19, with an additional 11 residents showing symptoms. These residents' tests are pending, and investigation continues to determine the source of the infection. Of the 2 other residents confirmed to have COVID-19, both are in stable condition. The staff member who tested positive for the virus had no travel history and did not work while symptomatic. Staff who were in contact with residents who tested positive will be identified and isolated. News of this death and other potential infections in a long-term care facility will be distressing for many people. You may be listening to me right now from a long-term care facility, or you may have a loved one who lives in one. Although I want to reiterate that most people who become ill with COVID will experience only mild symptoms, it can make others very sick. This is why we have taken the extreme measures we have, and why I cannot emphasize enough the importance for all Albertans to follow all public health guidance. We are continuing to look at additional measures for continuing care and long-term care facilities that operators and staff could implement to further limit the risk for residents. As soon as these are finalized, we will communicate them. As I've said before, we will take all steps necessary to protect Albertans' health. In addition, we are continuing to look at additional measures to prevent this virus from spreading further. The percentage of the population that eventually gets infected is only one dimension of what's important. The other dimension is over what time period does that percentage get infected. So if you have 30% of the population infected over a 1-month period, that has a very different impact from 30% of the population being infected over 3 to 4 months, for example. And we talked about flattening the curve, and essentially that's what we're trying to do, is to make sure that that spread happens as slowly as possible so that those who do need care get it. And that is eventually what will help us to reduce the total number of deaths and severe illnesses from this disease, is to make sure that we are spreading that out over a longer time period. I know that this is scary, but we will get through this. This isn't just about the actions that the government is taking. It's down to each and every one of us. Practice social distancing if you go outside, even if you are just taking your dog for a walk. Today's report of a second death and the increasing number of affected Albertans is why these aggressive measures are in place. And it's why every day we are working together to ensure that we are doing everything we can to stop the spread and keep each other safe. Every single Albertan has a role to play. The restrictions we have put in place on mass gatherings, the closures of public recreation facilities, and the limitations on restaurant capacity are all in service of this goal. We all need to take these measures seriously. If you are sick, stay home. Do not go to your doctor's office, ER, or clinic unless you have symptoms that are of an urgent nature. Take the COVID-19 self-assessment. Follow its recommendations. Call HealthLink 811 if instructed. And most importantly, and I cannot say this enough, stay home if you have mild symptoms of cough, fever, shortness of breath, runny nose, sore throat, because those are the symptoms, even if mild, that can be linked to COVID. The health and well-being of your family, friends, and neighbors are at stake, and we all owe it to each other to take this seriously and keep each other safe.